name is Dr. Ripo Efiongedik. I'm a consultant gynecologist, a chief consultant, specialist in gynae endoscopy, gynae oncology, and a fertility doctor. I'm an advanced laparoscopy surgeon. I want to talk briefly about laparoscopy, minimal access surgery, medical term called laparoscopy. Some people call it keyhole surgery, while some people call it buttonhole surgery. Keyhole surgery in the sense that you just have to make tiny incision, cut. Incision means cut on the patient's belly, very tiny incisions, and through these incisions, cameras, telescopes can be introduced, and smaller instruments. Incisions usually not larger than 1 centimeter. You know how small 1 centimeter is. Then the other smaller incisions, they are small as 0.5 centimeters. That is very, very minute, and that's what we call that. We term it minimal invasive surgery or minimal access surgery. It simply means introducing telescope into the patient's belly, what we call abdomen, medical terms. The peritoneal cavity, introduced to the patient's belly. And then the essence is to visualize, with the intent of visualizing, identify the cause of the patient's problem. It can as well be used to do surgeries. For patients that already have been diagnosed of having known conditions. As a gynecologist, patients that have been diagnosed with fibroid and different conditions. Yes, I'm going to give you indications. Indications means reasons for which these conditions, causes that warrant laparoscopy. Laparoscopy can be used to diagnose conditions, medical conditions. It can also be used to treat, to do surgeries, to operate conditions. Yes, what are the reasons we use this condition to diagnose? One, we can use conditions for patients that have infertility. Infertility means inability of a couple to conceive after 1 year, despite frequent copulations. For those patients that have infertility, you can use it to check their tubes to know what the problem is. And can then use it to check, of course, the peritoneal cavities. They may have scars that could interfere or interface between the tubes and the ovaries. And this kind of this condition can, if there are scars interfering, it can prevent the pickup of egg by these tubes, and hence the patient is unable to conceive. You can use this laparoscopy to diagnose conditions like what we call endometriosis. Endometriosis simply means implantation of the inner lining of the womb outside the womb. It can be on the ovaries, but as long as it's outside the womb, it's called endometriosis. So such that each time the woman menstruates, whatever during the menstruation, the same thing occurring during menstruation happens wherever those glands, the tissues are implanted, and it can account for severe pains in women. With time, this is going to be a series. We'll have a session where we'll have to talk about endometriosis. You can use this to diagnose other conditions like patients that have been having pains, severe or chronic pelvic pains, severe menstrual cramps. You can use to diagnose patients that have chronic pelvic infections. You can use to diagnose cases where we call unexplained infertility, where they've done different tests and they can't identify the cause of the problem. With laparoscopy, you can use this to identify what the problem is. And then, of course, these conditions can be used. Laparoscopy can be used to do surgeries. Lots of surgeries. For patients that have fibroid, we can use laparoscopy to do the surgeries. Patients that have ectopic pregnancy, young girls. These days, you don't have to undergo big cuts for you to have surgery done on your tubes. With laparoscopy, minimal invasive surgery, this can be achieved. And of course, their benefits will come to that. You can use it for patients that have ovarian cysts. There's growth in their ovaries. You can use this to do surgeries. Patients that have cancers, early stage cancers, of course, like cancer of the cervix, very early stage, cancer of the womb, cancer of the ovaries, very early stage cancers. This condition plays a role it can play a role. And of course, even appendix, inflamed appendix, you can use this laparoscopy to do surgeries. And the patient can go home the same day and start eating, of course, the same day. Then you can use this for patients that have problems with their womb, the elderly ones or those advanced in age that have already achieved fertility desires. These ones maybe with troubling fibroid with heavy bleeding. With this laparoscopy, can use to remove the womb where they've completed their family. Then you can use this to remove their womb. So many other indications. We can use this for even patients that have prolapsed uterus, urinary incontinence, and all this can be done. I'm not just saying things. All this you can do it at our center, Hopealive Endoscopy and Fertility Clinic. Thank you. God bless.